Hi, good morning. My name is Kristine Tagle and I'm the owner and the teacher of Macquarie Preschool. Welcome to our podcast. And joining us today, the doctors from WunderKids.
My name is Dr. Daryl Lanzuela. I'm an ambulatory pediatrician and I'm one of the doctors from WunderKids Multidisciplinary Center. Nasa lang po kami, Scout Gandia.
And I'm Dr. Doreen Mystica. I'm also one of the pediatricians in WunderKids. I'm in the primary care arm of WunderKids because I'm a general pediatrician.
Today, I've invited sila Doc kasi I kind of want to talk about the red flags. Sometimes, ako as a parent, fails to see with my kids. The amount of guilt sometimes is big. Kasi with us teachers, di ba, we would always see and check red flags. No, but sometimes in our personal life, sometimes we fail to see with our own children. I kind of want to understand. I kind of want to see it on the parents' eyes, not on the teacher's side. So, kayo po ba, with your experience, Doc, usually sa bahay, ano po yung pwede naming red flags if the children has special needs? Of course, pag sinabi po nating special needs, encompassing po lahat, tama po ba? Ano po yung usual na red flags that the parents need to?
Siguro, before we touch on the red flags, I think it's important to know then what the normal is para mas ma-understand natin bakit naging abnormal to, ganyan. And so, with the topic of what's normal, parang dun yung pumapasok yung mga developmental milestones. No? So kids, although they are different from each other and they don't follow one mold naman talaga strictly, they still have yung parang mga achievements ba? Yun yung mga milestones, no? That we as pediatricians tend to check, no? Whether they achieve it at a certain time or not. No? So yung mga milestones na yun, they are divided into the different developmental domains. So that would be 4, yung mga developmental domains na yun. So, motor skills, how they move, how they do the big movements like walking, running, etc. And how they use their small muscles. So, yun yung mga fine motor skills. And then, we also have mga language skills. So, that's their ability to understand and to say what they want to say. Tapos, we also have the socio-emotional skills. Yun naman yung parang how they interact with their environment and how they interact with their caregivers, their peers. And then we also have yung mga cognitive milestones. So yun yung mga medyo mas academic in nature. So it tackles yung mga attention, memory, and naming, etc. No? So yun. So these kids will parang go through the milestones according to those domains. No? So normally what will happen, yung development, sinasabi yan na cephalocaudal in nature. Ibig sabihin, parang magsa-start from the head papunta sa baba. So, yung unang ma-reach na milestone ng kid is makokontrol niya yung head niya bago siya matuto maglakad. No? Tapos, ganun din, parang, I forgot the term, pero from the middle outward, ganun din yung development. So, ibig sabihin, mas kaya ng kid na dalin muna sa midline yung kamay niya bago siya mag-reach ng something in front of them, no? So parang ganun po yung pattern ng development man. No? So if for example, the societies of pediatricians, meron silang sinet na ages kung kailan ma-achieve ng mga bata yung specific skills na yun. And if they fail to achieve that, then that is one of the things na kino-consider natin if we say red flag. So for example, di siya nakapag-lakad at like for instance 18 months, no? So baka there's something wrong about the motor skills, no? And that's a red flag, no? So ayun, yung isa parang that's how I see it.
When speaking about the red flags, usually during the first year of life, wala pa yung masyadong complaints because the parents would mostly focus on the physical ailments. Baby ba namin may rashes, may cough, may sipon. And then, lo and behold, pagdating usually ng 1-year-old, maaga ng 1-year-old na may complaints yung magulang, usually by 2 or 3 years old, you would actually go to the clinic and would say, Doc, yung anak namin parang hindi pa nagsasalita. Pag may comparison with other children, yun na parang sa amin, mas red flag na yun. Actually, any complaints from the parents, whether it is shallow, parang mababaw lang yung complaint, or kung talagang may nakikita kaming mali, we consider them serious na. Kasi yung parents naman talaga yung nakakapag-observe sa children, sa mga anak nila. So what we do first is, tama naman si Doc, we assess muna ano muna yung normal talaga. We have to also consider, kamusta sila sa bahay? Especially nowadays, the parents would say, Doc, laking COVID. COVID time po kasi kaya nagkaroon ng developmental problems. Actually, we don't really consider COVID times, yung lockdown period. Malaki yung factor na during those days or during those time, parang mas dumami yung bata ng mga complaints developmentally. But even without the lockdown, ang malaking factor kasi dyan, kung ano yung setup nila sa bahay. So, yes, we can screen for red flags, but more importantly, we have to also screen ano yung strengths, ano yung weaknesses ng mga magulang, ano yung meron sa bahay. If we control that thing, yung sa bahay nila, it will follow yung developmental behavior, yung management. It's easy to advise, pero mahirap din if we say ano yung dapat gawin sa ganitong red flag. Our management, our advice is basically the same. They're all similar. Pero we look at them per family basis. Madali magsabi na gito yung gawin mo, gito ganyan. Pero pagdating sa bahay, iba pala yung pattern nila. So we really have to engage with the family. So it's family level management, not just the therapy na focus sa bata. So speaking of red flags, again, maraming red flags. We have this table in our society na kapag ganito yung milestone, hindi pa niya na-achieve by this age, red flag na sa amin. So,
Would you
kailangan
recommend,
tingnan.
Doc, na kapag hindi niya na-reach on a certain age, e-therapy na ba?
In ambulatory pediatrician's point of view, not all would require therapy kagad. When I was a trainee, when I rotate in developmental pediatricians, OPD, they always say that the therapy, the rehab, is not always the first line. It will always start what we call as the home management, home interventions. Maraming pwedeng gawin sa bahay na hindi nagagawa sa therapy. In some cases, for example, children who have cerebral palsy, epilepsy, or other neurological problems, doon kailangan may therapy kagad. But for children, for example, parang behavior lang yung problem, sobrang kulit, may pagka-delay sa speech onte, kung wala namang problem neurologically wise, we can start muna sa bahay.
I think yung take ko dyan, ma'am, is pumapasok dyan yung kahalagahan noong seeing your pediatrician regularly. Kasi, for example, sa perception ng parents, they think that it's a red flag, but I think the wisdom of going through the parang regular well-child consultations with a pediatrician na nakaka-monitor talaga sa skills and sa well-being ng isang child is that nakikita ng pediatrician kasi kung paano yung progress ng child in terms of the abilities that they can do. No? So kaya yung mga therapeutic interventions, it will just come in kapag yun nga, sabi nga ni Doc Daryl, no, we scrutinize talaga kung ano ba ang home environment, what surrounds the child, no? Because essentially, if we, for example, we advise therapy, mga therapeutic interventions kasi ma'am would be just 1-2 hours of the child's time, no? Samantalang the entire day, the child will be at home or in school, no? So mas malaking role pa rin yung piniplay ng parents and teachers in the intervention of the child, no? So the OT, the speech therapy, they're just there to kind of provide a model kung paano siya gagawin. And then essentially, that skill that they learn from the therapy must be continued at home and in school still, no?
Kung naalala ko, Doc, when we came here sa Manila, I would always have my daughters check. Kasi nakikita ko yung mga iba kong students, kita mo yung special needs nila. Sometimes when the child is super intellectual, they tend to mask the delay. We would know here in school, based kasi we do Montessori, the Montessori program focuses on observation. So what we do is, children of 25 to 30 in a classroom, usually there are 3 teachers. 2 would teach, 1 would observe. So the teacher that is observing would observe how the child would get the material, how the child will use it, why is the child not getting a material, why is a child not working with peers, and all these things. So we've noticed that some children who are very intellectual, they mask the red flags. And we can see when they start with socializing with peers. As a parent also, when you read about these things and you can see it with your own eyes, I would always ask my children to be tested. To the point that they asked me, "Mommy, is there something wrong with me?" Hindi ko naman maitago na, "Dok, pwede ba sabihin ko po, hindi po kayo doktor?" Pwede po ba? So of course, they would see you. Of course, they would see the clinic. Even how beautifully designed that the clinic is, they would sense that it's the clinic and we're tested. And it would always say, don't worry, it's okay, no? But as adult, also, there are pala late diagnosis.
Right.
So, with special needs, for example, ADHD, it's different for children, for boys and girls. Usually, the boys, you can spot it straight away. The girls pala, 12 years above. And it's crucial at the time because it's during their high school years.
Right.
And then now, suddenly, these things would come to light. When I read about these things, and I converse with the parents and the teachers, sometimes ang ending namin, di ko na nga rin alam, hindi na rin namin alam. Ano ba? Kasi sometimes naman, we would say, uy, baka may special needs, or we would tell the parents red flag. Pero after a few years in the Montessori environment, parang hindi naman, parang nakahabol siya. Oo. Nung sinabi niyo po, Doc, with the pandemic, we had a lot of children tagged under the red flags as per the Montessori method, few years after the pandemic. But after the program, parang hindi ko masabing nawala, Doc, pero hindi ko alam kung ano yung tamang word. Parang they progressed and then they eventually developed on their own pace. So I guess the environment, that's just what you've said, really matters. And the family, home environment that you've said earlier, plus the school, then additional with the developmental pediatrician visit, siguro all combined, nag-progress yung bata. So right now, looking back, I can still see some of these parents. Sometimes we would ask ourselves, so, ano yun? What did we see? So, pag ganun ba, Doc, ano po yung explanation?
Kasi ma'am, diseases for them to be parang qualified as diseases or disorders has to be parang one of the criteria that's similar across the board for any disorders should be parang impairment in function. So if that criteria is parang satisfied, then we can really consider that the disorder is present. However po, in some cases, children will exhibit traits. So just traits, no? Hindi siya magko-qualify as a disorder. Because disorders, we have to be very careful in labeling the child with a certain disorder because the criteria is strict. For instance, in ASD or autism spectrum disorder, we follow a very, very strict criteria of a child having difficulties with social communication and presenting with restricted and repetitive forms of behavior. So if a child, for example, satisfies only one of those two criteria, then doesn't meet the diagnosis. The child is just exhibiting some traits that are related to it, but not necessarily having the disorder. No? So in ADHD, ganun din, ma'am, no? Because it's very strict also. No? So the DSM-5 TR would have like a symptom list that the child must present. No? And in ADHD specifically, the child has to be presenting these symptoms in two settings. Tapos, in children, we can see it at home and in school, no? And in other settings, for example, birthday parties, yung mga ganyan, no? So, yun, very strict yun. And on top of yun nga, on top of those criteria, the child has to be affected functionally. So, for example, in school, the child cannot perform because very, very sensitive yung kanyang sensory processing. For example, yung mga super light sounds lang, they'd be very distressed. So if that's the case, then yun, the child would fall under the disorder. And regardless, kaya din po maganda yung yun nga, no, na regularly the child gets checked and everything. Because if we see the trait, then we know what to do about it. No? Regardless of whether the child has a diagnosis or not. No? Because we know what we can do in order to parang maximize the potential of the child and to kind of get over that trait and kind of adapt even with those traits present. Paano makaka-function yung child, paano siya makaka-adapt sa environment na kinakabilangan niya. So, yun yung bakit may differences between a child na parang mukhang ganito, but then apparently nung na-expose in a very supportive environment, nag-change at nawala yung ganitong mga symptoms. Yes.
Minsan nung mga nag-start kami, may nasabi yung parent na, ay, pasok niyo sa Macquarie kasi nakapagsalita yung anak ko there. So, pero siyempre, I would take it as a compliment,
Yes.
no? But I told the parent, we don't do miracles here, no? We just made an environment that supports the needs of the children and observation. What happened to that specific setting is that sometimes kasi, we tend to overhelp children. So with the Montessori setting, they're very independent here. We would teach them 5 works per day. And on the next day, we would ask that child if they can get a work that we taught from yesterday. So if you're a child who had been always told of what to do, that's different. Where you can choose. As you can see the child, hindi pa yan kukuha eh. Kasi parang, really? Are you giving me the freedom? Eating as well. They don't have the freedom at home sometimes because of the nannies, the presence of the caregivers and the nannies here in Manila. They don't have the freedom to help themselves. So the tendency is the caregivers would feed the children and they would be asked to finish food that they did not get themselves. In the Montessori setting, they would do everything on their own. The child was able to speak because we stopped over-helping the child. So imagine a setting wherein you need water, but you don't have to ask for water. Nandiyan na.
Right.
Nahulog yung the utensils or the napkin. May pumupulot agad. Magic. No? So the child doesn't have the need to say, ate, mom, dad, can I have another napkin or another fork? So that's really what we did. We stopped over-helping. So we loved it when parents come here to observe the children, especially the grandparents. I love having them. Kasi what we do with the observations here, they just sit in one side of the classroom, not to interact with the children. We ask them to observe. They are amazed of what these 3 to 6-year-old children can do, and even the toddlers. We have toddlers from 18 months to below 3. So those are the good thing about what we do. You've recently opened
This year,
WunderKids.
open, yeah.
The WunderKids. Kindly tell us about what the clinic does or...
WunderKids Clinic kasi in a line of the Universal Healthcare Law. Usually, it's during the time of President Duterte when Universal Healthcare Law was being implemented. So when we say Universal Healthcare Law, by 2030, ang plan sana for the whole country is that all clinics would be one-stop shop. It is based on the healthcare from Canada and US, wherein all families have their own doctors. And all families, for example, meron kang problems, for example, you have a problem sa heart. Here in the Philippines, you can directly consult a cardiologist. Kasi may kilala ka ng cardio or ni-refer ka na, hindi ka nadadaan sa family physician, hindi ka nadadaan sa general physician or sa IM or pag sa bata sa general pediatrician. In the US and Canada, iba yung structure. All of the patients or clients will go through a family physician first. So, GP muna. So, here in WunderKids Clinic, hindi pa siya namin pinapractice yung ganun, pero papunta na doon. In WunderKids Clinic, what's good about that facility? Most of the specialists are there already. We have noticed that during the past several years, most of the children, usually, ang complaint nila, not their complaint, actually ang complaints ng parents would be about their development. It's like our new non-communicable diseases. In adults, pinaka-common hypertension, diabetes, stroke. In children, ang mas nagiging common na autism, ADHD, learning disorders, speech delay. So ano na siya, pataas yung prevalence of those kids having neurodevelopmental behavior. So ang nangyayari po sa WunderKids Clinic, most of our patients there are kids with special needs. And ang kagandaan pa doon, here in the Philippines, mahirap makakuha ng developmental pediatrician.
Super.
Konti lang kasi sa Philippines, and at the same time, ang partner dapat ng DevPed would be rehab team. Kasi most of them would require therapy na eh. In WunderKids, if they are seen by a DevPed, they can be referred directly to a rehab on the same day or in the same week, and ang kagandahan, same place. So you have seen the DevPed and you'll be seen by a rehab. And meron pang SPED class at meron pang mga therapy sessions that can be done also in WunderKids. And hindi lang DevPed yung meron pa sa WunderKids. We also have different subspecialties. Meron na pong neurology. Meron tayong pedia-neuro, meron tayong pedia-gastro, nutrition. So for those patients, actually when speaking about nutrition, hindi siya masyadong natatakal sa consults. Hindi po siya natatakal.
Is feeding therapy part of undernutrition?
Yes, meron po.
Yeah.
So for those kids na may problem, malnourished because, for example, may tuberculosis or, for example, may maple syrup urine disease, it's a genetic disease, WunderKids can cater those kinds of patients na malnourished kasi may sakit. So, you can drop by if may mga concerns sila. Not just the nutrition, meron kaming surgeon na rin. So for those patients na gusto magpa-circumcise, pwede circumcise tuli. Not there, pero meron po kaming parang surgical center wherein patients can go there, schedule, and then kung kailangan ng circumcision, go. Pero kung ibang concerns, pwede rin po doon. So we are still an enlarging facility, and what we can boast about our facility is that it's a one-stop shop.
It's the first in the country, Doc.
Yes, it's first in the country wherein, for example, DevPed lang yung habol mo. And yet, may na-identify yung DevPed na problem. In the same day, pwede ka makita ng isang subspecialty pa. It's a big project. Actually, not all clinics have this kind of algorithm. So, nakikita namin yung kahalagahan talaga ng developmental health ng mga bata.
We are actually super happy when we've heard about it. Kasi our problem naman is sometimes, yung tama po kayo, when we see a red flag, we would tell the parents to consult yung developmental pediatrician. And then the booking, they would be asked to wait mga 6 months. I started nga giving some of the students referrals to the province. Kasi sabi ko baka mas madali. Kasi some cases kasi is urgent. Kasi di ba hanggang 6 years old lang kami. Urgent because next year gagraduate na yung bata. And we are not doctors, we are teachers. I would love that we would have a second opinion. And we would like it that the child would be intervened ASAP, other than what we do in the Montessori setting. When you told us about the therapy, Macquarie had opened also a Montessori therapy section of our program. This is to cater children with special needs who are not yet ready for inclusion. So what we do here, we deal with the student one-on-one. We give the child a Montessori environment, similar with what we do with the speech or with OT. And then when the child is ready, slowly we would push the child to inclusion. I really loved it when we had WunderKids kasi ang bilis lang, ang lapit. Sabi ko napakalapit po. And we have close coordination. With the other doctors kasi and the other clinics they are so busy.
Right.
I am only able to talk to the secretaries, and then sometimes kasi we need PTCs with the pediatrician or the therapist or the OT. Not for anything else, but to plan how we would do our lessons. And it's wonderful to see if all of us are on the same phase for the development of the child. Having close coordination is crucial other than just reading the IEP. Kasi the IEP, lahat naman ng report is there eh. You can just read. Pero it's still different to have, that close coordination on face-to-face or Zoom or Google other than the report. So, mas maganda pa rin for the child. Doc, may question pala ako with tongue tie. Does it affect kasi some parents didn't want yung surgery. Naisip ko lang, Doc, when you mentioned that you have your surgery then, does tongue tie?
We call that ankyloglossia.
Okay.
Yes, surely it will really affect your speech. Kasi parang at the bottom of our tongue, may parang ligament doon.
Ligament,
If it is short, limited lang yung movement ng tongue,
Yes.
which would eventually affect your how you talk, your
Okay.
speech. Actually, we just cut it down, yung ligament.
That's a day surgery lang.
Oh, it's a day surgery. Hindi na siya need for a surgical consultation or referral. Pwede na siya sa clinic, kinakat lang siya.
So, WunderKids pwede rin.
Pwede siya ikat lang.
May sinasabi lang ang parents na hindi teacher, baka mag-grow into it. Totoo po ba yun? Hindi ko po kasi alam.
Di ba? Di ba?
So, hindi. So, doesn't matter. Kahit mas malaki na yung bata, hindi siya may stretch.
Hindi po. Pero the outcome would be speech affectation. Some of them parang mag-outgrow onte, but you can still hear yung problem
the list.
nila. If you look into their tongue, may tongue tie nga. So, yun siya.
How we check kasi, we ask the child to place their tongue pataas. Kapag hindi nila nagawa, parang sabi ko, okay. Kasi minsan hindi mo makikita kasi usually the preschoolers, hindi naman talaga sila verbal, or they're verbal pero not as clear when they talk. So pag narinig namin, nakaka-sad kapag hindi namin nasabi sa parent. Tapos sasabihin 3 years sa amin, diba? Tapos hindi namin nasabi. So, yun, very, kami with that.
On top of yung sa speech na magiging parang affectation, feeding din also becomes an issue kapag ka tongue-tied yung kid. No? So, kaya it's very important really.
Talaga ba, Dok?
Yes, Dok. Kasi parang yung tongue is parang, di ba, hindi siya makaprotrude ng maayos. And then, the tongue is essential for parang mag-suck ng milk yung child, para itulak yung bolus ng food
So,
behind.
possible ba na kapag hindi maka-breastfeed, may factor din si
Yes.
tongue-tie?
Yes. We see that a lot po, no?
Oh,
Kapag,
wow.
kapag may problems with like latching ang baby, and then we check, and then we see na tongue-tied pala, then it gets snipped. After snipping, then okay na yung child. Better ang feeding, no? So, it really has a lot of effect. Hindi lang siya sa speech, no? Yung talagang yun. Tas, eventually, syempre, if feeding gets affected, nutrition, and then nutrition also has a negative impact if it's not optimal sa development. So, that's, I think, one of the parang nice things about WunderKids is ando na talaga lahat, ma'am, no? So, and when we see a child which can have problems much later, wala pa dyan yung problem, but we can anticipate, no? Referring to other specialists are medyo mas madali siya because
Easier,
everybody is there, yes. And the doctors can talk amongst themselves then.
What I love about WunderKids, yung when I visited, is the sensory room.
Yeah.
As an adult, it made me question myself if I have ADHD. Kasi when I went inside, suddenly, na-block yung noise. It's semi-soundproof. But suddenly, parang na-block po. And then, may few lights. And then I asked Doc, what do you do here? So, medyo madilim eh. So, sabi niya, kasi when children nagtatantrums, before the therapy, wala pa tayong magagawa, right? Tama. Sa Montessori method, when the child is here and is not regulated, we won't be able to do much of our work when they are not regulated as of yet. With the therapy, which is usually 1 hour only, they have less time to regulate the child. With us, with the Montessori method, we have more time because in school they are usually 3 hours here. So we would encourage the child to do self-regulating activities, usually the practical life. Feeding of the fish, watering the plants. Usually, tumitigil po silang umiyak. And washing of hands. You want to wash your hands? So, minsan may biro po with Montessori kids. Nagaling daw po maghugas ng kamay. You always wash hands, alright? So, that's what I love about one of the physical environment that I haven't seen in other facilities is the sensory room. So, can you tell us something?
Pero yun nga, ma'am, no, parang ginagamit siya for regulating the child because when a child has a very heightened emotion, wala ka talagang magagawa na anything. And any attempts to control, to bring the child back to reality, parang ganon, it won't be effective at all. So, the sensory room kind of cuts off all the other parang noises so that the child can focus on regulating themselves. Kasi as you said, yun nga, very limited yung time ng child with therapy. And if the child continues to throw a tantrum for 45 minutes, then 15 minutes na lang yung natira for the actual therapy to happen. So it becomes very counterproductive in a way. So, I think the sensory room is there to, to make the most out of the session. And on top of that, some kids would also have mga sensory processing issues, no? And I think that also comes into play, yung sensory room. If we want, there is a therapy method kasi that is called yung mga sensory integration, ganyan. And I think that also functions yung sensory room in that type of an intervention. Siyempre, depending on what we see in the child, kung ano man yung hyper or hyposensitivity niya, no? So, it will all depend on that, on what the child presents and how the child is pagdating niya in the actual therapy session or in the actual consultation session. Kasi sometimes, even during consult, they will throw a tantrum. Your evaluation wouldn't really be finished kasi wala na, hindi mo na makuha yung yung attention ng child. The child is busy with other things na, so...
Kasi bago sa kanya the environment. Ako would usually tell the parents sa school, no, what helps with regulation is consistency.
Yes,
Really.
yes.
Like adults, when we go to a party and we know what we are expecting, it eases the tension of small talk with people, or where do I sit, where I should position myself, what would I wear. With children, it's like that. If you are consistent with the routine, if you are consistent with what you do, it lessens their tantrums. It helps them with self-regulation. Dati when we were also starting, minsan may mga bata na teacher ayaw pumasok, nasa car lang yung bata. Nabiro ko the parents, sabi ko, how wonderful, ano? Kasi nung araw, pag ayaw namin pumasok, palo eh. Ito, hinihintay natin lumabas sa car, ano? Parang, ang galing, no? Ang galing po, the things that we do. And parenting is really, has a different approach and evolved throughout the years because of the amount of information that we receive. Kanina when you said feeding, when we've heard of feeding therapy, I'm not sure if I've heard it during my university years. When we saw it here, we joked with the other teachers, teach, nagkamali tayo yata ng trabaho. Kasi nasa isip namin, feeding therapy, pag feeding parang kain, parang masaya, parang ganyan. Uy, may feeding therapy pala, sayang. Sana pala, ito yung tinake natin ng college, ganyan. So, but kidding aside, ang laki po ng factor ng feeding talaga. Because if we give a child food that is always mashed or soft, the muscles in the tongue wouldn't develop. Hence, would affect their language and their speaking abilities. Kaya kinailangan pala the feeding therapy. Children who are too picky also, that would always eat selected food in the food group, would also tend to have language problems and speaking difficulties. Ang galing that it encompasses a lot of things. Kayo po ba, Doc? Just out of curiosity, narinig niyo na po ba yung feeding therapy during nung school days niyo?
Actually, when we speak of feeding therapy, may iba-ibang level.
Okay.
May family level, may patient level talaga kung saan physically may limitation. For example, yung tongue tie. Others naman hindi makakain kasi neurologically may problem. So may level siya. Going back to the tantrums, then magpunta ako sa picky eater. Tantrums is a normal behavior. Other parents would say, abnormal to kasi tantrums, hindi natin makontrol yung bata. You would really control the tantrums. Tantrums is like their way of expressing themselves. So imagine, if tantrums are normal for all children, how much more for those with special needs? They have this difficulty in speaking, and yet, hindi na ma-express kasi in the first place, may problem na sila. So the tantrums would be worse for those patients with special needs. So what we do, may kami tinatawag na time out, na kung saan, well, similar siya sa sensory room, kaya may ganun. In time out, everything would be controlled. Meaning, for example, yung anak mo sobrang nagwawala na, umiiyak, and there's a formula to it. The number of years until 10 years old lang. So for example, your child is 4 years old.
Okay.
So 4 minutes of time out. old school, ang naisip nating time out, face the
the
wall. Actually, may negative din siya, implication. Kasi embarrassment, hindi siya maganda tingnan. When you say time out, sige for example, yung anak ko, Sam, please sit down, 4 minutes lang. They won't understand 4 minutes. Sit down lang. Then, sabihin natin 2 years old yun ako, 2 minutes lang, tahimik lang. Okay, if you are behave, do you wanna go play outside, ganyan.
That's how you do the time out.
Yes, a time out. And if child is having tantrums, do not leave the child. Make sure na wala kang response, but at the same time, you're still there. Just make sure na alam nila nung mga bata, andyan yung parents ko, hayaan lang nila ako mag-tantrums. And after the tantrums, if I'm already okay, Mommy, Daddy, I want to play, I want to eat. Makikita mo naman after tantrums, na sila eh. Calm na sila. So, the presence of even nannies, parents, being there during tantrums, they would realize, andyan pa rin yung parents ko. Iba ang tantrums sa tinatawag na meltdown. When we see meltdown, usually sa sa areas or settings in which first time nila or hindi sila familiar, usually sa mga mall, outside, children would tend to lie down, cry. In meltdown, similar sa tantrums, heightened expressions, emotions. They have immature brains. They don't know how to regulate their emotions. And it's their way also of learning how to regulate their emotion. Tama po, hayaan lang. And then after that, 1 or 2 sentences na, ano yung dapat gawin kapag may gusto siya? Sam, next time, just say what you want. Then yun na siya, ganun na siya. And then for the picky eating, for the feeding therapy, ang picky eater kasi usually nagpipick siya, 3 years old, 4 years old. And it's normal pa din for their behavior. For example, if the child likes noodles mataas sa
Yan
sodium.
din yung naisip ko ngayon.
Noodles. What we can do is to replace noodles with healthy foods, alternative. So ano yung pwedeng alternative? Miswa. So ano din siya, parang noodles din siya, pero healthy siya. Gusto ng fried chicken. Pwede naman fried chicken din naman, pero halo si tinola, mga ganyan. So make sure, mahirap siyang gawin, madali mag-advise, no? But make sure to have a healthy alternative. Then, if the child able to, for example, eat healthy food, and rather than the junk foods, then give a prize. Nowadays, we don't give food as a prize. Because of that, ito lollipop, ito candy, but sometimes guilty ako doon, no?
Pero, iba nga talaga na, Doc, as a parent, as a doctor or sa teacher.
Yeah, but there are studies nowadays that if you give food as a prize, na for example, behave sila yung mga students, cupcake, food, later on, they will develop obesity. If we offer not the food, but for example, play, going outside, any activities that are productive and fruitful, mas effective siya. So, ganun siya. No? Picky eater, another advice, kung ano yung food lang sa pagkainan, yun lang siya. Do not force the child, kasi kung nagutom din yan, kakain din naman siya. Yun yung, even me as a parent, guilty din sometimes, that fino-force mo, lalong aayo yung bata. The more pressure, the worse it will be.
For me, Doc, madali sa school setting, kasi peer pressure talaga really works. So sometimes when the parent is telling us the child is picky eater, we would say, kami po bahala. Kasi nasa isip na alam na namin eh. Tatabi namin sa mga batang okay kumain, makain ng gulay. And iba nagagawa. And pagdating sa bahay, sasabihin na niyan sa'yo eh. Mommy or Daddy, my classmate has this baon. It's nice. But it's gulay, right? That's one. One thing that we also do here in the toddler community, which is usually when I started, it's 0 to below 3. However, in Manila, when I started, no one is enrolling for the infant group yet. I think the idea is new at that time. I'm not sure now. So we extended to just 18 months now, but we're open to 0. Just like how we do it in Australia. What we do in the toddler community, we stop asking the parents to bring baon already. We have breakfast buffet. So in that breakfast buffet, we introduce food that is usually not eaten in Manila. When we started, I noticed that a lot of the baon contains, this is not to judge, no? I also do it. donut, and then you have sugary drink. So in Australia, usually it's just water and fruit for snacks. Usually the parents know that. In Manila, it's not usual. It's not usual. We changed it. So the toddler community, we did that. We noticed that when the food, on the onset, they don't touch it. But if it's always in the table, on the table, most likely they would touch. We also noticed that if we place so much variety, it's difficult, no? In one setting. So if you want variety, maybe introduce on the next day. We try to introduce a lot of sour food, your yogurt, olives, pickles. I don't mind if they just lick it. I just want them to have the taste of it. And then when they see their teachers eating with them, they tend to eat more of the food that usually they don't like. So when you place this on the setting sa bahay, when the parent eats with the child or without the distraction of the gadget.
Yes.
So by the way, I don't think the gadget is too bad. Growing up in the 90s, I think we are also submerged in gadgets from 10 a.m. to up until midnight, no? But that's a conversation for another day. But if they are eating without the distractions or without them feed, kasi sometimes they would have TV and then the adult would feed, no? The child needs to self-regulate because they don't know if they're full. So in adult life, the effect is, alam niyo po yung feeling na busog ka na pero gusto mo pang kumain. That's it Kasi hindi ka pwedeng tumayo before nang hindi ubos ang pagkain. But you ask who got the food for you. It's an adult scooping your rice. It's an adult giving you the sabaw. And your stomach is this big. So you're trying to finish everything so you can go out and play or you can watch TV. That was the effect as an adult now. So now, what we do here in school and maybe with WunderKids and most of the parents at home that are listening to us, we let the child scoop.
Yeah.
And if sometimes makulit, no? 1 spoon lang. Mommy, I finish na. Good enough. Good enough. And then before you sleep, they would tell you, we're hungry na.
Ma'am Kristine, in here po ba in Montessori, do you also like provide styles of food, shapes of food, parang may face, parang for example, pancake, tapos may banana.
We would design it. No?
Right.
Si toddler, pamisa we do it. Si preschool kasi they have baon. So, on the beginning of the school year, we tell lang the parents, encourage food to eat. Ang funny there is, sometimes a parent would say, "Uy, sorry yan, baon ng anak ko ngayon is ito unhealthy, sorry na." Nagsasabi na sila. Sabi ko, no, it's okay po. Or what we do is we encourage lang. Cupcake, it's okay once in a while, but not every day. But up to you po, at least you know, no? Awareness is one thing. Alam mo, na you weren't able to do it. We do food preparation at least a few times in a month. So that's when we cook in a group setting with the kids. So that's when we do, the pieces, the designs, we would ask them to maybe design their own food and everything. So, yun po.
Connection to feeding and the things you've said, ma'am, about it, no? But it just goes to show na yung feeding is not only for sustenance, no? Parang siya, very collaborative, very inclusive in a way, and very behavioral also. No? So, because yun nga, in relation to also yung mga feeding therapy, it's not only that the child is picky. Sometimes, the child did not see a model with healthy eating habits, kaya ganito yung child. No? So, sometimes also, it's a sensory problem. For example, the child doesn't want to eat rice. For us, parang ang arte, bakit tayo kumain ng rice? Pero baka pala in the child who cannot express well yet his or her preferences, baka pala when he is eating rice, iba pala yung sensation that the child is feeling in his mouth, no? Kaya may aversion dun sa pagkain, no? So kaya very important and very beautiful yung presence ng feeding therapy because all those gets assessed during the feeding therapy and the feeding evaluation. Kasi parang hindi lang siya hindi lang maarte yung child, kaya siya ganito, kaya ganito yung behavior niya around food. And what's nice also about the the way you do it in the Montessori way, no, is yun nga, you include this child with their peers who can serve as their model kung wala silang nakikitang model, for instance, at home. Kunyari, busy yung parents, can't really share a single meal in a day, no? So, it makes them parang, okay, so because everybody else is doing, it might be right. And because children my age, no? So, kumbaga, parang yung mga barkada ko, they're doing it, I should be doing it also. No?
Especially, Doc, yung bento box.
Yes.
Or nauso siya.
Yes.
So, ang cute nun. Kaya lang, ang aga lang natin gumising.
Oo, no.
Para mag-ikot. Magtupi. Para nakapagtupi kayo, Doc. Ako naman mag-ikot ng rice. I didn't last. sorry na. But I think part of parenting is forgiving yourself.
Yes,
Now, for the things that you did and you did not do. At the end of the day, this is not a phase wherein you judge other people also. At the end of the day, it's about love. I think it's about love. I would always tell the parents and the teachers that if you love the child, irregardless if you're a student or the child, I think from there, you can grow from there. Can't do much harm. No, from there. And of course, there's no manual. We don't also know the exact blueprint on how to do it. And community really helps. Community really helps. You talking to people who had done it. For me, I love talking to a lot of people from different industry. Like, I would always, this is a joke that I would always tell my husband. I love talking to the friends because it's personal. I love talking to the religious group, to the father and the sister, because they give a religious setting. But they would pray for you and all, and for the children. But I also love talking to people like you, Montessorians like me, because it's based on science. Data would always have a preference on a lot of the things we do. Actually, before we end, the difference with Montessori and the other progressive approach is that with Montessori, we are not play-based. Right. So, in here kasi when we do the school tours, they say, teacher, I know, do you know po a little bit about Montessori? Para alam ko lang, where will I start or with the school tour. If they say play-based, in reality, Montessori is really not play-based. It is developed by Maria Montessori, which is a doctor, based on science. She started with observing the children. So with observations, you have your hypothesis, you have your theory, and then you have your conclusion based on the data that you've gathered. So everything that we do here is based on science, and I think 80 to 90% can't be wrong if it's data-based. So I think that sums up what Macquarie does, and it sums up what WunderKids does. I hope that from this podcast, people would have a reflection of what they kind of want to do in the future. It's never too late. Last pala yun, it's never too late. Intervention would always be the best option. Yun lang. Anything else, Doc?
First of all, thank you for inviting us.
Wow, galing din ako.
For this podcast.
Parang, Doc, you're a natural po.
I'm thinking
galing
kasi
po.
it's another avenue for both Montessori and WunderKids to provide insights, especially for our kids' health. And it's good that we have this Montessori Macquarie kasi number one, it's an avenue for children to develop their social skills. Second, it's a structured environment. I think that's one of the advantages kung bakit once they start going to any school, mas nag-develop yung skills sila because it's a structured environment. And hopefully, they would be able to adapt these skills sa bahay. So, ideally, 3 years of age pwede na. So, again, thank you and see you po sa WunderKids if you have any concerns. But again, speaking as a pediatrician, it's always better to see your children sa clinic than seeing your kids in the hospital. Ibang-iba talaga. So, Thank you.
Then, Doc, can you tell them where is WunderKids?
WunderKids is just near Capitol sa Scout Gandia. Fourth floor.
Number 3, Gandia.
Yeah, number
South
3.
Gandia. Bose Coffee is parang nandun sa ground floor. Tapos fourth floor is yung place ng WunderKids.
Please feel free to visit their social media pages.
It's in Facebook and Telegram called WunderKids Multidisciplinary Center. Actually, just type WunderKids, lalabas na kami.
WunderKids with the U.
Yes.
Yeah, with the U.
Yes. All right.